Synthetic drugs present a unique challenge to international drug control to preserve the health of the global community. Unlike the production of plant-derived drugs such as cocaine and heroin, which are geographically constrained, synthetic drug manufacture can occur anywhere, depending on human creativity and a few key chemicals. This fluidity makes the productivity extremely mobile and any country a potential source. More specifically, in 2023, the World Drug Report identified that methamphetamine has emerged as the prevalent synthetic drug with manufacture and use expanding in Southeast Asia, North America, Southwest Asia, Africa, and Europe, with seizures tripling in just 6 years. A growing number of laboratories have been detected in Central Asia, Southeast Asia, the Near and Middle East, Africa, Europe, and North America, producing a range of stimulants, depressants, and other novel dissociative. Synthetic opioids have claimed tens of thousands of lives in North America through overdoses, the majority associated with fentanyl. Synthetic drugs have also emerged as a threat in fragile and conflict-affected areas. In Latin America, the markets for MDMA and ketamine are growing. Africa continues to struggle with the non-medical use of tramadol. The Middle East is flooded with captagon pills and ketamine becoming a mainstream drug in some population groups, and seizures are hitting record levels in Southeast Asia. These are regional manifestations of a truly global problem. In contrast to plant-based drugs, the ability to chemically synthesize immensely potent drugs at a low cost has opened doors to huge profits for criminal groups and daunting new threats to security, development, and health around the world. It is hard to take action or talk about effective responses without understanding the chemistry behind synthetic drug manufacture. The capacity of forensic drug analysis laboratories to provide verified information on chemicals found within synthetic drug samples is essential. Let's not forget that precursor chemicals are essential to the manufacture of synthetic drugs. If there are no precursor chemicals, there can be no synthetic drugs produced. Illicit manufacturers are circumventing the use of internationally controlled substances through minor modifications to synthesis pathways and use of non-controlled designer precursors and new psychoactive substances, many of which originate from pharmaceutical industry research and development efforts deemed as failed or substandard substances. Online discussion forums through both the clear and dark net present hidden platforms for illicit manufacture to exchange information and know-how on designer precursors, pre-precursors, new synthesis pathways for production of novel synthetic drugs. It is crucial that national, regional, and international drug control efforts and policy decisions are guided by science. The dynamic nature of synthetic drug markets requires adaptable solutions and more integrated responses. The global synthetic drug problem, which has resulted in significant loss of lives, calls for coordinated, comprehensive, and multidisciplinary response. The UNODC synthetic drug strategy is articulated through 4 complementary spheres of action. 1. Multilateralism and international cooperation. 2. Early warning on emerging synthetic drug threats, or preventing crises before they happen. 3. Promoting science-informed health responses. And 4. Strengthening counter-narcotic capacity and support for international operations to disrupt trafficking in synthetic drugs. Since launching the strategy in 2021, UNODC has supported over 45 countries to strengthen national, regional, and global responses to helping countries enhance health responses, early warning, and counter-narcotic interventions, and supports multilateral responses. In particular, through its corporate synthetic drug strategy, UNODC is building capacity of countries to identify, detect, intercept, and take action on most harmful, prevalent, and persistent substances, improve effectiveness of border management and criminal justice systems to more effectively interdict trafficking, adjudicate, and disrupt related organized crime. In addition to providing scientific and forensic services to assist more than 300 national drug testing laboratories in more than 90 countries, UNODC has developed the UN Toolkit on Synthetic Drugs, an open-source platform which provides over 380 cross-cutting resources and tools to support countries in implementing the guidance articulated in the UNODC synthetic drug strategy. Available in all 6 official UN languages, the UN Toolkit on Synthetic Drugs is currently relied on by over 85,000 users from 203 countries and territories. The challenges ahead are immense and require international cooperation and coordination to step up global action to effectively address the challenges posed by synthetic drugs and ultimately save lives unduly lost.